Hi everyone! Now, how many of you out there are having trouble being able to straighten your elbows? I get it from my weightlifting friends quite a bit. I get emails from, I can't just straighten my elbow. And then what happens if you can't straighten your elbow, you end up with forearm pain, tendonitis in your elbows, or even sometimes worse yet, carpal tunnel. So stay tuned and I'm going to teach you the best exercise for that. Alright everyone, I'm going to give a shout out to my mentor of the Institute of Physical Art, Greg Johnson, and the functional mobilization paradigm. We call this the elbow plie. I think this is a great exercise to try to mobilize your joint and even strengthen and stabilize all at the same time. So we're going to do that here, and what I want you to do is, I'm going to show you my more inefficient side. This is my right side. It doesn't really straighten all that much. If I just kind of let it unlock, it just stays there. But this one, if I let it there, it's doing pretty good. So what you want to do is you kind of find a hard surface, like I'm sitting right now, and then you want to kind of create this little plie movement, so that's where I think Greg got it from. And what we want to do is we can either check one of these sides, but ideally it should be springy, and you can see this side isn't as springy, so this is a little bit more stiffer. So what you can do is you can hold this like this little nook here. It should be a nice hollow, but I feel a little bump, and it's usually a little bit tender. So these are the people that generally start getting that forearm, that tennis elbow type pain, or I always get that a lot, but sometimes it's just a joint that's a little bit off axis. So what we want to do is we're going to go ahead and press in and push, and then we're going to relax. You're going to press in and push. I'm putting a great deal of weight into it, that body weight, and then what happens is sometimes it clicks in and sometimes it just gets in slowly. Obviously, check it with your healthcare professional, make sure this is the right exercise for you, because you might be hurting some structures, so just be careful, but make sure this is the right exercise for you. So I do this quite a bit, then I can hold it there, and then I can re-educate myself, and then I can work against it. Once it's in the right axis, this is great. This is great for my swimmers, my pitchers, my volleyball players. I get that all the time here. And so what we want to do is here, we're going to go here, and then that. Now you can see my more efficient side. I think this is great to see here. So what we want to see is, does this ability, so you can see this is springier. This is much springier when I push right here. And there's actually a very nice little divot here. So this is much springier. I can do this all day, no tenderness, no pain. And that's what you want to look for. So what you're going to do is, how do you set this up again? So let's talk about that one more time. So here's step one. You want to put some weight in. It's like doing a little side push-up. And then what you want to do is then you're going to do this motion. You're going to rotate like you're smashing a pancake. And then you're going to go right in here and you're going to push. You're going to go right in here and then you're going to push. So, and then you block it. That's the third thing. So you want to block it. And then you can re-educate it after. Hold, and then work right into it. And then that's how you start getting rid of that tennis elbow. That's how you start getting rid of some of that nerve pain that runs right there. You got some radial nerve stuff that goes down there, and you want to avoid that. So if you like what we're doing, please subscribe below, leave some comments, or you can email us at rehabandrevivemedia@gmail.com for any bright ideas. We love getting your input. So I'm Dr. Lin of Rehab and Revive Physical Therapy. Remember, we can and we will get better together.